Hey everyone, Christian here with your tip of the month. Today, what I'm going to take everyone through is an understanding of our hip flexor muscles, what they are, what they do for us, and how they can impact our posture. And then, of course, what we can do to stretch these out, because for a lot of people, they do become really quite tight. For many people, particularly desk workers, these are the types of people who will probably find they get very tight hip flexor muscles. Our hip flexor muscles, which are reasonably deep in our hip area, those muscles are responsible for lifting our knee. So they hold us or lift us in that position. If I'm a desk worker, I'm sitting at this position for extended periods of time. And when I'm in this position, that muscle has become shortened. Whilst it's shortened and it's used to being shortened for how often do we sit? 8 hours a day, it then becomes tight. When we've got a tight hip flexor, and now I'm standing, that tight hip flexor starts to pull my hips and it rotates them forward into a position that we called anterior pelvic tilt. So my hips now become rotated forward, and you can see that creates excessive what's called lordosis, an excessive curve in the lower back. That shortens my back muscles, crunches me up into the spine. That can start to produce a little bit of lower back pain. That weakens the core for a lot of people too, and it's a really uncomfortable position to be in, and then it can cause further issues down the chain, which we won't go into right now. In terms of stretching it out to create a little bit of hip flexor relief, and then also so we can help address some of the postural issues, an effective way of stretching the hip flexors is to use something soft underneath your knee, a pillow, roll up a towel, or if you want to do it in the studio, grab a mat. You're going to prop yourself into a kneeling position with one leg. Your knee will be underneath the hip, your foot will be forward of the knee. We're now going to, instead of doing anterior pelvic tilt, which we talked about, we're now going to do posterior pelvic tilt and rotate those hips underneath by using that glute muscle to squeeze and assist in that rotation. Now, when your knee is underneath your hip and you do posterior pelvic tilt, you should notice already a little bit of a stretch to that hip flexor, maybe a little bit of a stretch down through that thigh as well. If that is not yet enough stretch, then we're going to maintain that posterior pelvic tilt and now just shift our body weight forward. And I'm going to try and hold on to that and not let go of it and let it rotate forward. Now, if that is enough stretch, sit with it. We want that stretch to be borderline uncomfortable, but not painful. If we still need more, we can then either prop that foot up onto something like a stair or a couple of books or something. Or if you've got the balance, you might need something to hold on to. We can kick into that hand and then start to get a little bit further into that hip flexor stretch, and you'll get further into that thigh as well. So if you're looking to really improve your flexibility with those hip flexors, remember anything that we want more flexibility with, or we want to see some improvements, we should do frequently, so daily, and you'd want to hold those stretches for about 30 seconds each.